So we were going to sort of talk together. And so Tracy has a mic. I did hear some ideas sort of floating around, which was great. So I think each one of you would just start and see what everybody has to share. So who wants to go first? Who has a great idea and wants to share? Go for it.
Well, our table had a lot of good ideas, but the one we liked the best came from Steve Eaton and Lincoln Gaston County. And he actually borrowed it from Mecklenburg, and then Mecklenburg borrowed it from Catawba County, or Catawba County borrowed it from Mecklenburg, and then he borrowed it from them. But it's called the Parent University, and he put together a website and also a no-cost community collaborative, I guess if you want to call it, for parents to come and listen to different sessions on anything from health issues, how to talk to your teenager about sex, how to navigate the system of getting child care. I don't know, maybe Steve should talk about it, but it sounds like a really great program. There's no cost, and the partnership does all of the marketing for it, and it allows local parents to connect with the agency representatives in their county that can teach them how to navigate the whole system. And Steve, you want to say anything about it?
Actually, we had watched this going on in other communities, and talking about the convener role, we were just basically the convener role of it, recognizing that there's so many resources within counties that are available to parents, but most of the time parents don't know where to find it. So what we did was we kind of took about 13 different local agencies. We all kind of dropped our names and kind of came together and put it under one umbrella and called it Parent University. And we got a grant to actually be able to do the marketing for it because it spans from birth all the way to age 18. So we used this grant to be able to do the marketing of it. But essentially it just is, we started off with a kickoff kind of major, modeled it kind of almost after a Smart Start conference at the Gaston College, and then now there'll be many seminars going on throughout the year where local agencies can actually pick from a menu of different topics, and these local agencies come together. So it was about coming together, dropping our names, and putting it all under one umbrella. So it's one website where parents can go to find everything related to raising children in the 21st century.
Alamance County has something called the Children's Executive Oversight Committee. And it is the director of every agency in the community, as well as our elected officials, county commissioner, representative of our hospital, everybody that impacts a child's life from 0 to 18. And we've been in existence now for about 4 years. And what we are getting ready to do is start a planning process where we assess our resources and our impact in the community, and maybe what we're thinking about is an entire forum or a one-day dialogue, and how we pull all the pieces together. Because what we're realizing, although we serve children 0 to 18, most of the people on the Children's Executive Oversight Committee have learned that if they take more of the resources that have been going into the juvenile justice system, put those on the front end, we're going to have better outcomes for children at a lower cost to our community. So it really is a broad-based group of people all focusing on children 0 to 18, but primarily 0 to 5. And let me just say that that's co-chaired by the director of our social services and me.
Fantastic. Again, back to the convener role, right? The example, both of those examples speak to our role as conveners in the community to get it to another altitude. Okay, somebody else.
Thanks, Tracy. Well, you know, we have so many unfunded needs, and one of the most egregious ones to me is the rising obesity in preschool. We have been talking about that and tracking the data that we get from the state partnership at our monthly Focus on Child Health meetings that are run by our health director. And we go to the and support the health department's health assessment process, and we're part of their steering committee. An offshoot of that was started a couple of years ago when obesity across the life spectrum was identified as a health priority for our county. This last year, our county commission but has funded a children's obesity coordinator for our county. And that coordinator is going to pull together all of the various things that are being done. We have community gardens here, we have church fitness programs there, we have knapsack in our child care through our child care health consultant. And so they're going to pull those together, and I think we're going to have a stronger initiative. We're promoting healthy foods policies, by the way. We're serving whole apples at our candidates forum Thursday night, and water. So we're excited about that. And at the same time, you know, that's taking money from other priorities that we have. We have 500 children on our waiting list in Child County. Never have heard that number before. So, it's a push-pull, but we're very pleased about the progress of moving forward without our money, the efforts to address obesity. And
yes, and I really think that is our future, is figuring out other ways to leverage other people's money. Not that they have a lot either, but the example of bringing little bits of money together to make the programs be able to sustain themselves. Yes, absolutely. Who else? Dawn?
I'm Dawn from Onslow County, and the system that probably has been the most meaningful in terms of building bridges and bringing people together has been the establishment of our Child Advocacy Center, which some of you have heard me talk about. We will be the third accredited Child Advocacy Center in Eastern North Carolina. Our services on many levels are lacking. It was a 5-year process. We did open our doors. The Child Advocacy Center, for those of you who don't know, serves children, depending on the community that we live and work in, it looks a little different. But it's children who have the most emergent needs in terms of either child sexual abuse or child physical abuse. It really is, it truly exemplifies a system and bringing a system together. And we were the convener and the catalyst for bringing people together. There's always been, in our community being one of the largest military communities in North Carolina, we've always, unfortunately, had one of the highest abuse and neglect rates in the state as well. So there has always been a focus and this sort of consensus that something needed to be done. And so when we brought people together about 5 years ago, we said, okay, we have an opportunity, we have the numbers, we want to do this. And there was a resounding yes. And to where we are today, we began serving children August 16th. We do have comprehensive services within the partnership. Smart Start is the catalyst. We have not had to use much of the money. There has been staff time, but it has enabled us to bring additional resources and funding, and also it will save a lot of money in our community because our children don't have to go to Greenville, which is about an hour and 45-minute commute. So we are trying to keep track of law enforcement's time, DSS's time, and the cases that we're serving because they don't have to spend the whole day on the road anymore going to Greenville. And of course for children, especially young children, having to make that trek, it's very difficult for families to take off work.
Great idea. I was able to visit this center before they had opened while it was still under construction, and it is a great example of pooling resources in order to get the children with grave needs, emergency needs managed. So it's a great building. And all sorts of people in the game. I mean, the real estate developer in the game, the military in the game, the local county commissioners in the game, everybody in the game, making it possible for those kids to do that. It's really a great, you should be very proud of it. It's a great model. So who else? What other good examples have we got? All right, Pauline.
I'll give an example of where Smart Start's not only benefiting the state of North Carolina, but potentially has an impact on all the other early childhood initiatives across the country. So that's exciting. I'll try to do this concisely. In our role as convener, the partnership with the Mental Health Association convened a work group, a study group, as we always do, to study the mental health issues of young children in Randolph County. And as a result of that, a good example of beginning, not worrying about is there money, but again studying the issue. Parallel to this, as the group concluded its work, the Randolph County school system was applying for a federal grant, Safe Schools, Healthy Students. It's a national grant. Only 3 in the state of North Carolina got it. What was timely is that the partnership had done the homework. And one component of that grant is the social and emotional development of young children. The rest of the grant is focused on substance abuse, alcohol, bullying, other related issues. And so it was timely that for us, they began to see that the partner was the early childhood community could best do this. And this isn't the case at the federal level in terms of what has potentially happened with this grant. It has now resulted in 5 years of funding to implement the work, which is much more advanced work on the Center for the Social and Emotional Foundations of Young Children. It enabled us to bring in a national consultant to jumpstart and have 19 classrooms that have piloted and over 100 teachers who have received in-depth training, as well as the assessment component in the classrooms. But the equally important is that the school system began to see in others this continuum. And what they were addressing was the results, bullying, substance abuse, and usually it's juvenile justice, the mental health system, and the school system who are partners. And then they went, aha, 0 to 5. The federal program officer has been down and has been so pleased that as a result, our work in Randolph is probably elsewhere. When the RFP comes out this March, you all, early childhood is a required component and needs to be on what they call the core management team because of our work. And I think that's a wonderful example of what we do.
Awesome. That's a great example. Yes, absolutely. Apply for those grants. We know several of the others of you have shared certainly Cindy Tuttle could talk about the work in AmeriCorps and how we sent that around for everybody to see. Would it work for you? Could you also address AmeriCorps? And then the Early Head Start grants. Who's here? Oh, Durham. Durham on the Early Head Start grant. Thank you, John and Onslow and Sampson. They're not here. So we know that the federal, accessing the federal dollars to prove that we've got the infrastructure and connections is really a great way for us to expand. I do want, anybody else? All right, go for it.
Guilford County recently received a launch grant it's a SAMHSA grant, and comes through the Division of Health Services. And we actually weren't part of the initial planning for this. It came together rather quickly with other organizations. But we're involved now, and we're playing sort of a secondary role in bringing folks together and patching holes and trying to make it all work. Some of the administrators are new to Guilford County, and so making them aware of systems that do exist and so on. And I've written this up as an example. The purpose of it is to bring together folks and build systems around early childhood mental health issues. There's some direct service money, and that has in some ways caused some dynamics that are not always positive, but I mean, it's very positive for the county, but everybody wants a piece of it. But it's an example of where we're playing sort of a different role here as a support, and those who are in the middle of it, I think they're learning a lot. We've brought on private providers, 2 foundations that are working on it, and they're learning a lot about early childhood. In the end, we might be the organization that can sustain it in the long run, but it'll be stronger because everyone isn't looking just to the partnership to convene it and make it happen. It's truly a community.
Great. It's a great example. We're delighted to have the launch grant in the state, and also to have the kind of the work that had started in Greensboro be able to be highlighted at the national level. So what else? Anybody else? Any other examples? You know, there are, each table has 5 or 6, and I certainly want to speak almost directly to my NCPC board members. It's always a treat for them, and as for me, to be able to hear the kinds of ways that the partnerships are filling the space that's left in their county in order to serve the children with whatever issues or opportunities that arise. So I think that's an important lesson for us at NCPC, to be really, to try to make it possible for each one of the local partnerships to be as agile as they can be inside this particular environment, because we know that with dwindling resources, we have to get smarter and smarter and smarter about making services available for kids and families with less money but more partners. And so I commend you all. Those are great examples. And I love the federal connection to the grants, and also love the on-the-ground work that everybody's doing relative to children's health and well-being.